So then we'll just go a little bit, oh yeah, big time to the medial aspect. All right, more time going on the outside. Push. Good. Quick one. Ooh, heel, nice, good. Hey guys, Dr. Mike here, Oak Brook Medical Group, Oak Brook, Illinois. And I'm back with Mr. Jose, our massage therapist. The man, the myth, the legend. Dude lifts cars on the weekend for fun. But he does a lot of strongman competition stuff. We've treated him sometimes in the past for his knee. It's flared up a little bit today. I actually just wanted to walk you guys through and show you how I adjust a knee. There's multiple different ways you can adjust a knee. I'm going to show you one because obviously I don't want to adjust his knee multiple times. That would just make him angry, and he's a lot bigger than me. I don't want him angry at me. So I'm going to show you one adjustment, and then I'll kind of explain the past couple. But when we look at the knee, you know, obviously with it being a joint, if this was the tibia, the shin, and then you got your femur, all of that motion there, what happens basically is this femur shifts backwards, and so it can create a little bit of a subluxation right there, and just puts a lot of tension and pressure on that knee joint. And then a lot of times what patients will tell me is, Doc, I don't know what's going on, but when I take that step, it feels like it's going to give out on me and I'm going to fall. So if that is you, this is definitely the adjustment you need. This is one of those adjustments that I can do on a patient, and they kind of look at me, they're like, you didn't do anything. And then all of a sudden 2 weeks later I see them, and they're like, look, I don't know what you did, but I haven't had that feeling since you did that adjustment. So it's pretty incredible. But first things first, we got to test his knee to make sure that he actually needs this adjustment. We just don't want to go all willy-nilly and just start adjusting people here. We got to make sure we know what we're doing. So face up for me, please. And yes, I just said willy-nilly. I'm not even really sure what that means. All right. Comfortable?
Yeah.
Good?
Yeah.
All right. So basically what we're going to do is I'm going to bring Jose's leg out here to the side. I'm going to put his ankle between my knees, and we're going to put some pressure or tension locking out his knee in extension, and then we push it side to side to check for that laxity. So coming out here, you just relax, Jose. Go comfortable. There you go. So right, and if there's pain, let me know.
Yeah.
Lock out. Okay. Are you okay? Can I go through with it? Or are you good? Don't swing at me, dude. All right, good. Watch his hands. So then we'll just go a little bit. Oh, yeah, big time to the medial aspect. All right, my man. So I'll give you my spiel on this adjustment, although Jose's had this before, right? But still, just so the patients know. Basically what's going to happen is you're going to flip over, you'll go face down. I'm going to use my thumb, and I'm going to put about 60 to 80 pounds of pressure right on the back of your knee, and you're just going to feel a little flip. The adjustment itself, you won't feel anything. It's not going to, you're not going to feel a big pop, click, crack, nothing like that. The only thing you'll feel is that pressure of the 60 to 80 pounds just coming from my thumb, okay? Here's the deal. If you wake up tomorrow and you go, what the heck did Dr. Mike do to me? My knee's way worse. That tells us you have a soft tissue injury in there, tore the meniscus, tore the ACL, things like that, right? We obviously know that's not your case. It's not like you came in here from an accident or anything like that. And that's why I always explain this to patients. If that's something that we are considering or that could be a possibility, we just don't even do this adjustment, right? We don't want to risk that. Of the hundreds and hundreds and hundreds of times that I've done this adjustment on patients, I've only had one person come back and say, hey, look, it hurt a lot worse the next morning. Sent them straight for an MRI. There was no tissue damage at all. They were just sore from the adjustment, right? So always make sure we're doing the right thing by the patient standards, but we want to get them better as well. So face down, please. All right. So remember, as I was talking with that shifting, if we think about him laying down, this is the tibia now and the fibula. Basically what we're, with that instability, that has shifted back this way. Okay, so what we're going to do is we're going to find those tibial plateaus sitting right back here. Always start on that medial aspect, and all we're going to do is take the thumb, push right there. This hand's just going to do the little flip. Again, it's going to kind of look funny. It doesn't look like anything's going to happen, but I promise you it works. So, little pressure there, Jose, 60 to 80 pounds. Good. One more time, going on the outside. Push. Good. On your back, please. patients walking in, I got to say hello. Can't just ignore them. All right, so now we did the adjustment. We always got to test the knee again afterwards. So come out this way, lock that in, and now we should be nice and strong. Yeah, now you're locked out, dude. That's not going anywhere. So, okay, so the other thing you can do, if patients don't need that adjustment, if it's, a lot of times that one, it's that giving out type of things when we're going to look at this. If they're just like, no, I just feel like I have pressure in there. Another one you can do, obviously I'm not going to do it because we just adjusted them. A lot of times you can just bend the patient's knee. We're going to sit and toes right there. I'm putting my hands behind and we're just doing a little tug. Just a slight little pull. Again, knee's one of those joints. You're not going to feel a big click, pop, crack, nothing like that. It's very minor type stuff. The other thing we're going to do, can I take your shoe off? Slide that right shoe off. So when we're looking at knees, patients have chronic knee issues. We always want to look at the ankles as well. And if you think about it, you're standing on your feet all day long, the pressure in that ankle or the ankle's not moving properly, it slides right up to the knee. So if we get that knee stronger, we want to get the ankle moving as well too. So we're going to drop this out straight and get a little adjustment in that ankle as well. Quick one. Ooh, heel, nice, good. There you go. And now he needs a bigger shoe too. All right? So come on up, sir. There you go. So if you guys are dealing with, see, look, he's already bumping into me. I told you he's bigger than me. I don't want to make him angry. If you guys are dealing with any type of knee pain, you have any questions about knee pain or what you might be dealing with, call us at that number below. If you're watching YouTube, hit the notification bell, like, follow the page, Facebook, Instagram, like and follow. Otherwise, Jose is going to come find you. Just kidding. He won't do that. We'll catch you guys on the next video.